Hello my dear student, welcome to Medical Anatomy. Today our topics of discussion is humerus. Humerus, first when we will be holding, your examiner may ask you which sided humerus it is, what type of bones it is and what are the presenting parts, then followed by muscles we can ask you. So first when we are seeing the humerus, we have to first identify which sided it is. You can see there is head of the humerus. Then after that there are two tubercle. Just after the head, lesser tubercle and greater tubercle. When we see the lower end, there is a large fossa. We are saying it is called olecranon fossa. These are some points you have to remember for side determination. How to determine the side? Head of the humerus should be directed upwards, backwards and medially. The lesser tubercle should be directed anteriorly and the olecranon fossa should be directed posteriorly or backwards. When we keep such type of positions, we can confirm the humerus side. So this humerus, which is right now in my hand, it is the humerus of my left side. After that, maybe your examiner asks you, humerus what type of bones? It is a typical long bone. This humerus, it is homologous with the lower limb 1 bones, that is femur. Now typical long bones, when you say, your examiner may ask you then what are the parts of a typical long bone. We know typical long bone have a proximal end or we can say upper end, then shaft, then lower end or we can say distal end. So humerus also same, it should have a proximal end, shaft and distal end. In case of proximal end, when we are describing, we have to remember there is a circular structure. Just now we said what is this? It is the head. Head, it will be covered by articular cartilage and it will be attached with the scapula, head of the scapula, and there will be formation of shoulder joint, which is a ball and socket variety of synovial joint. This head, it is an example of pressure epiphysis. After the head, there are neck. In case of humerus, there are total 3 neck. So let's start the 3 neck description. First neck is just after the head surrounding. This is the anatomical neck. So this anatomical neck, the circumference following the head constricted area is the anatomical neck. They may ask you what is attached into the anatomical neck. You have to remember in the anatomical neck there will be attachments of the ligaments of shoulder joint. What is the name of this ligament? Capsular ligament of shoulder joint. Then maybe they ask you in which area the ligaments is deficient. You can see in between these two tubercle there is a groove. In this area there will be deficient of this capsular ligament and inferiorly it is also little bit below, not just completely encircling the anatomical neck. So this anatomical necks and capsular attachments. After this anatomical neck there is a surgical and morphological neck. The surgical neck is the junction between the upper end and shaft. So approx this will be the location of surgical neck. And as it is a surgical neck, so always you have to remember that there should be something clinically important in relation with the surgical neck. What is that? We have to remember surgical neck, anteriorly there will be anterior circumflex humeral artery and posteriorly posterior circumflex humeral artery and axillary nerve. Axillary nerve, we have to remember it is coming from posterior cord of brachial plexus. Then just little bit above the surgical neck, around 0.5 centimeter above the surgical neck, there is one more neck which is called morphological neck. We can just here make a dotted line and you can see a little above there will be the location of morphological neck. Morphological neck is actually the junction between epiphysis and diaphysis. Okay. In case of a growing long bone, in this morphological neck, here will be the location of epiphyseal plate of cartilage. So, after the head, the necks we discuss. Now, in the proximal end or upper end, there are 2 points to be discussed. One is the lesser tubercle, another one is the greater tubercle, and in between these two tubercle, there is a groove. We are saying intertubercular sulcus. In the lesser tubercle, there will be one attachments of muscles. Name of that is called subscapularis. And in the greater tubercle, we can remember by a mnemonic seat, supraspinatus, infraspinatus and teres minor. In between these two tubercle, there is a groove and this groove have 2 leaves. One is the medial leaf, we can say this is the medial leaf, this is the lateral leaf and there is a floor. In the medial lip of this bicipital groove or intertubercular sulcus, there will be attachment of the teres major. In the lateral lip of this intertubercular sulcus, there will be attachment of pectoralis major, and the floor it will be traversed by the latissimus dorsi. You can remember by a mnemonic lady between two major. Then we may also ask you that through this intertubercular sulcus, some structures are descending and some structures are ascending. What are that structures? So you have to remember the descending structure will be the long head of the biceps with its synovial sheath, and ascending structure will be the anterior circumflex humeral artery ascending branch. Then we may also ask you regarding the lesser and greater tubercle, that what type of epiphysis they are. As it is a long bone, we know upper end contain epiphysis. As already I said, head is a pressure epiphysis. Lesser and greater tubercle, a number of muscle is attached here. So we will say these two tubercle are example of traction epiphysis. After the upper end, we may say about the shaft. This shaft have borders and surfaces. There are three borders. One is the anterior border, this is the medial border, and this is the lateral border. Among these three borders, there are three surfaces. This is the anteromedial surface, this is the anterolateral surface, and behind there will be the posterior surfaces. So the shaft contains three borders and three surfaces. Among these, you just remember towards the anterolateral surfaces area, there is a roughened area. We are saying V-shaped roughed area. This is the deltoid tuberosity. What will be attached here? There will be attachments of the deltoid muscles. On the posterior surface, there is a groove, and this groove contains radial nerve and profunda brachii artery. So name of this groove is called radial groove. Profunda brachii artery is the largest branch of brachial artery. Shaft, in the anteromedial surface, there will be a small foramen. We are saying name of this foramen is nutrient foramen. Through this nutrient foramen, nutrient artery will be entered inside the femur to supply to the humerus. In this shaft, there are some other muscles attachments also. You can remember in this lower part of the anteromedial and anterolateral surface, here will be attachments of brachialis. In the upper part of the medial surface, anteromedial surface, there will be attachment of coracobrachialis. And on the posterior surface, above the lateral groove, there will be the triceps muscles, lateral head, and below the radial groove, there will be the attachments of triceps muscles, medial head. Now, I said a number of muscles attachment. Now, if your examiner asks you among these all muscles, who are origin, who are insertion? Let's see. I said deltoid tuberosity. This deltoid tuberosity will be give insertion of the deltoid muscles. If we see posteriorly radial groove above, the lateral head of the triceps will be origin from here. And below the radial groove, medial head of the triceps will be origin from here. And we said in the upper half of the medial part of the shaft, medial surface of the shaft, there will be attachment of the coracobrachialis. Actually, coracobrachialis insertion will be here. And the lower half of the both anteromedial and anterolateral surface, there is the attachment of brachialis, and this brachialis will be origin from here. These are the shaft related information. Now we are going to discuss about the lower end. Lower end you can explain two ways. One is according to the articular surface, means these bones articulating with what are the other bones and forming the joints. On that basis we can say lower end have two parts, articular and non-articular. So this is the capitulum and this is the trochlea. Trochlea attached with the ulna and capitulum attached with the head of the radius. So of course these two should be the articular part, and remaining whatever the other structures here are present, they all will be non-articular. So who are non-articular? This is the medial epicondyle, this is the lateral epicondyle. Above the capitulum, this is the radial fossa. Above the trochlea, this will be the conoid fossa, and this posteriorly this is the olecranon fossa. So these are all non-articular. I again repeat, articular will be capitulum and trochlea, non-articular will be medial epicondyle, lateral epicondyle, radial fossa, conoid fossa and olecranon fossa. This is one way you can explain. Another way we can explain also according to the capsular attachment. So with this red marking, if I do attachment stressing in this lower end, we will see the capsule will be attached such a way. So capsule is attached such a way means this red color marking inside all are intracapsular. and outside these two are extracapsular. So who are intracapsular? Capitulum, trochlea, radial fossa, conoid fossa, and lower half of the olecranon fossa. These all are intracapsular, and extracapsular will be medial epicondyle and lateral epicondyle. Now in this image we will be showing you the muscles what we discussed with the bones in relation. So you can see here there are some muscles they denoted with the blue color and some with red color. So here you just remember the red it denoting origin of the muscles and blue it denoting the insertion muscles. So you can see in this lesser tubercle there was attachment of subscapularis, and in the greater trochanter there was some muscles we remember by a mnemonic sheet supraspinatus, and there should be more posteriorly infraspinatus, and there is minor also. These are the muscles who are inserting. In the lesser tubercle and greater tubercle after, we will be discussing about the intertubercular sulcus. You can see in the middle there is latissimus dorsi. Laterally there will be the pectoralis major, and medial lip there is teres major. So we can understand that these all muscles are inserting here. On the anterolateral surface of the shaft again there is a muscles, this is deltoid. So deltoid also insertion here. And on the anteromedial surface of the middle of the shaft there will be coracobrachialis. This is also insertion. So we can remember this all the muscles in the upper part of the humerus and the upper half of the shaft of the humerus they are insertion giving. Now in the lower half and even in the lower end of the humerus also red color. I already said red color denoting the origin muscle. So we can see in the lower half anteromedial and anterolateral surface we can see there is a muscle, name of this is brachialis. So brachialis origin from here. And in this lower end of the humerus we can divide, which is the supracondylar area, lateral supracondylar ridge. Here will be the medial supracondylar ridge. In the lateral supracondylar ridge there is one muscle origin, name of this is called brachioradialis. Keep in mind it is the muscles of forearm, and forearm more specifically posterior compartment of forearm 1 muscles. So this muscles is originating from the lateral supracondylar ridge of the humerus. Below that there is one more muscles also originating, which is also a forearm muscles and posterior compartment of forearm muscle, name of this is called extensor carpi radialis longus. After that in this lateral epicondyle we are denoting here that there are common extensor of the forearm muscles origin. Come for the medial sides. On the medial sides, medial supracondylar ridge area above the condyles there will be origin of one muscles of the forearm. But now we have to remember this is the forearm anterior compartment muscles. What is the name of this? Pronator teres. And of course in the epicondyles area there will be common flexor origin of forearm muscles. Which compartment? Here also these are anterior compartment. Now we will be showing in the posterior surface of the humerus what are the muscle attached. In the posterior surface of the humerus, in the mid shaft area, especially above the radial groove and below the radial groove, there will be origin of muscles. What are that? Lateral head of the triceps origin from the above radial grooves area, and below there will be the medial head of the triceps origin. So radial groove above, lateral head of the triceps origin, radial groove below, medial head of the triceps origin. Same you can see in the medial supracondylar area, posterior also we can see brachioradialis and extensor carpi radialis longus. And more posterior in the medial epicondyle area there is one more muscle origin, name of this is called anconius. And this anconius, it is a posterior compartment of forearm muscles. Posterior compartment of forearm muscles. Now, when we see in the posterior anterior aspect of the lower end of the humerus, I already said there are some common flexor origin muscles which is also again viewed here. Other than that, we are also asking some of the clinical importance related with the humerus. Humerus, different area can get fractures and relevant some of the structures can be get injured. If we see here, this is the surgical neck of the humerus. This surgical neck of the humerus already we know, here will be the relation posteriorly axillary nerve and posterior circumflex humeral artery, and anteriorly anterior circumflex humeral artery. So if the surgical neck get fractured, so there will be injury of the axillary nerve. If mid-shaft fracture, we know mid-shaft fractures means radial groove will be targeted. So radial groups if targeted, there will be injury of the radial nerve. If there is supracondylar fractures, there is a possibility of injury of median nerve and brachial artery. And if there is medial epicondyle fractures, here will be the possibility of injury to the ulnar nerve, as ulnar nerve is passing behind the medial epicondyle of humerus. One more question sometime we are asking, what are the nerves directly in relation with the humerus, or simply what are the nerves in relation with the humerus. If your teachers ask you what are the nerves directly related with the humerus, you should say number 1 axillary nerve, number 2 radial nerve, and number 3 directly related with these bones is ulnar nerve. In front, median nerve. But if they ask you what are the in relations nerve of brachial plexus in the humerus, that time you should add even musculocutaneous nerve also along with this all. Thank you.